Okay, so let's go ahead and get started then. So just very quickly, Medicare has 4 parts, A, B, C, D, and then if you choose A and B and do not enroll in a Plan C or a Medicare Advantage, then you have a Medigap plan. So basically what we're going to do today is really go through sort of how this Medicare.Gov website works. What it gives us the opportunity to do is to really see what information is on your record and how to track your Medicare benefits. So the first thing to do is that when you start out, you will go to Medicare.Gov, and this is the opening screen. I know that it's a little bit small in terms of what you can see. We have done some screenshots, which hopefully will help you to figure that out a little bit more. So we start the open enrollment and we can look at the 2022 drug plans, or we can log in or create an account. Then we can basically get some information on the coronavirus. There's some tutorial information on how to get started if we want to find providers, if we have to, for some reason or other, enroll in a 2021 plan. For the most part, the only reason people would have to do that is if you need coverage in December because your birthday is in December. You might still have to sign up for a 2021 plan. And then there's a way to talk with individuals. So the very first thing then is that you want to put in the URL that you are going to Medicare.Gov. That's where you want to be. You want to then log in or create this account. So in order to log in, if you already have an account, that's the easy thing. But if you are new to this process and you need to sign in, the very first thing that you need to do is to create a username, and then you'll need to create a password, and then you need to go in through login. So it's the standard process, if you will, in terms of how do you set up and set up an account. So the first thing that you're going to see once you get your account set up basically is information around your current plan. So if you are currently in a Medicare Part C or a Medicare Advantage plan, it will tell you that. It also will tell you what prescription drug plan that you are currently enrolled in. So it looks like in this particular instance, our test case is enrolled in SilverScript as their prescription drug plan. The second thing that it does is it tells you here when coverage starts for your Part A and your Part B. In this instance, this particular individual became eligible on October 1 of 2008, became eligible for both Part A and Part B on the same date. Some people will have a start date of Part A that is different than the start date for Part B because they have deferred their Part B enrollment because they may already have a employer retiree plan that they are able to continue to work with. You basically then, there are 6 areas down here at the bottom in terms of the different kinds of information that you can track. So the first one is claims. The second one is premiums. The third one is managing your account. The fourth one is updating or printing your drugs. The fifth one is printing a Medicare card. So with this, if you lose your Medicare card or it becomes pretty ratty and tattered, or for some reason you need a duplicate, you can print one from here. And then the last one is looking for different kinds of providers that provide Medicare services in the United States. Obviously, what we probably are most interested in is who provides services in Colorado. We also are able to then print a report on any of these areas that we might be looking for information. So the first thing we want to take a look at then is claims. This information at the top is going to stay static. So it will always be there in terms of what plans you're currently enrolled in. You will be able to view information about those plans if you want to refresh your memory or whatever, and then your coverage information. So we're going to start then initially with the claims down here. So this again is kind of a simple slide and very small in terms of what the information is that you can access. Across the top here, we have the deductible amount. We also have a copy of your Medicare summary notice. So some of you may remember that Medicare Part B always has a deductible of $203 this year, expected to go up to $217 for 2022, but we don't have that information at the moment. There's also a Part A deductible, and it will also tell you whether or not you have met that for the particular 60-day benefit period if you have had to go to the hospital. The Medicare summary notice is basically going to give you information about the Medicare services that you have used in the previous quarter. And then you can search this by the last however many days you want, 30 days. You can search by whether you want all of your Medicare claims or just some of them. So if you want your durable medical equipment, your Part B, whatever you want. And then you can also sort by the most recent services, or you can sort if you have an old claim or something that you're looking to get more information about. Then you have the claim number, you have the start date, you have who the provider is, who the what type of service it is, and then what Medicare has approved. So in terms of the claims data that this particular one has, it repeats this information at the top here in terms of the claim number, tells you that it's durable medical equipment, gives you the account number and the Medicare number, also gives you information about the date of the service. And then over here, it tells you what the billing address of the provider was, as well as who delivered or who provided the service. In addition, so this is basically, it focuses in on this information. The other thing it gives you here is that this is an assigned claim. What that means is that the provider, AeroCare in this case, has agreed that the amount of money that Medicare approves for this service is the total amount of money that they are going to accept with your that 80% plus the 20% copay. In this particular instance, because it's durable medical equipment, they have to accept assignment. They don't have the ability to ask for any additional monies for excess fees. The second section then is the payment summary. So the amount that the provider charged was $220. Medicare approved $82.88. In this instance, the deductible had already been paid by the client, so there was no charge. There's no deductible for this for blood. There's no physical therapy, psychiatric, occupational therapy. None of those charges apply. we get down here to the bottom then, and it tells us that Medicare is going to pay $66, and you as the Medicare beneficiary are going to be responsible for $16, or it could also be paid by your insurance company. So the third section then of that was the procedure details. And basically it tells you that this is the first claim. It then tells you the procedure code when you receive a bill from the provider, or when you go to the doctor or the hospital. Every procedure that is done has what we call a procedure code. And it is this procedure code that basically determines the amount of money that will be paid by by Medicare, and how much the vendor will in fact receive. Oftentimes when there is a problem with your billing, this procedure code sometimes is the wrong code. So I always tell people, if you have a claim that has been denied, the first thing you want to do is call the provider back and ask them to consider or to look at the procedure code and make sure that that procedure code is accurate. This tells you that there was one oxygen concentrator provided on a delivery port, and it was able to deliver 85% or greater oxygen is what it's telling you. Tells you that the insurance and or the individual will have to pay the $68, gives you the date, tells you the maximum amount charged, and the amount that Medicare paid. So the next thing that we're going to take a look at is up here, if you remember on the initial screen, was the amount of the deductible. And so that will be the next thing that we can check on this particular screen. So when we look at the deductible status, we see that for 2021, the deductible was $203. And for this particular claim, there is no deductible due because the deductible has already been paid. This screen, for whatever reason, also shows you all the previous deductibles that have been paid back to 2001. The next thing that we have here is premiums, if you recall. So that is this little button here. Again, on the initial screen, talks about how to pay your premium. So premium, basically, you may get a notice that says you can't pay your premium online, but that doesn't necessarily mean that you have a problem, because for the most part, the Medicare Part A does not require a premium. Medicare Part B has a premium that usually is deducted from your Social Security check if you are receiving Social Security. If you are not receiving Social Security, then you do have to make a payment, and that's when that will show up here. And Medicare Part D, you can either have your premium deducted from your Social Security check, or you can make a monthly payment. So basically, this particular person says that you can't make a Medicare premium payment online. And that is basically because this beneficiary has already having his premium deducted from his Social Security. This also reconfirms that the monthly premium, the amount in 2021 of November was $148. And it basically says that you don't get a bill because it's deducted. If for some reason you need to pay a premium, you actually pay the premiums through Social Security. You do not pay them through Medicare. So you will need your bank account number and your routing number. If you want it deducted, you need a credit or debit card, and make sure that you monitor your balance because Medicare will deduct your premium automatically from your bank account. So the next section then is manage your account settings. So that is the third area, if you will, that you can manage through this My Medicare account. So the different kinds of information is that it asks you whether you want to receive the Medicare and You book, and if you want to receive it in English. The second thing that it asks you is if you want all of your information about Medicare sent to you via email. And the third thing it asks you is if you want to get the e-Medicare summary notices, or whether you would like to have paper copies sent to you via the mail. So what we can see in this instance is that this particular Medicare beneficiary is English speaking, and he does not want to get his Medicare and You handbook on an email copy. He wants it mailed. He also does not want to receive any email notices about preventive services or other things like that. And he wants his Medicare summary notice to be mailed to him. So you can see how that works. In terms of prescriptions, so now we're on to the fourth box over here, which is managing your prescriptions. So the first thing that this is going to give you is it gives you a list of the prescription drugs that you have put into the plan finder and that you are currently taking. Even if you don't use the plan finder, it will still save those. So the first drug that is saved for this particular client is meloxicam of 7.5 milligrams tablets. It's a generic. His prescription is basically for 90 pills, and he gets it every 3 months. So now you can add another drug, or you can look at the next drug. One of the things that the prescription drug finder has is that if you have a drug, which it looks like in this instance is Lipitor, and it will, when you start putting it in, it will autofill the box for you, which is helpful. And they have included this new little pop-up box, if you will, which is that if there is a generic, it will give you the name of that generic, and then you can either accept the generic or you can go with the brand name. So in this instance, the individual has accepted the generic. So it's atorvastatin. It's a 40 milligram tablet. You can change basically the quantity if you take 1.5 pills, or one twice a day, and then some days once a day, if you need it 90 pills, and frequency of which you get that. Then basically when you're done with that, you click on add to my drug list, and now you have a full list of the prescriptions that you are taking. The fifth thing that this particular website will allow you to do, it will allow you to print a copy, as I said earlier, of your Medicare card. So you do have to click in 2 different places. One is up here at the top in that original banner that always comes up. So you click on print my card there, and then you go to the icon in the middle and you ask it to print your Medicare card there. You do have to put in your password. You hit continue, and then a new copy of your Medicare card will appear. You hit print my card, and then you will have a new copy. You can also order a new copy if you would like by sending or clicking that, and it will automatically send a message to the Social Security folks and lets them know that they should issue you a new card. The last area that this particular website provides is something called Find Providers. So you can find and research and add different kinds of providers depending on what it is that you are looking for and how you want to proceed. So it gives you the ability, if you will, to add a provider. This gives you also the ability to create a report that lets you, as well as all of your providers, know who it is that you are seeing. So it can provide you with additional information in terms of care coordination. So it can give you information about whether or not who your neurologist might be, who your podiatrist is, where you get your durable medical equipment, who your primary care provider is, or whatever. So at this point in time, and Medicare keeps improving this, there are 8 different types of providers that you can select in terms of the types of providers you want to get more information about. So the first one is that you can get information on doctors and other types of clinicians, such as nurse practitioners. You can get information about hospitals. You can get information about nursing homes, home health agencies, hospice providers, inpatient rehab facilities, long-term care hospitals, and dialysis units. So those are the 8 different types of providers that accept Medicare, that you can learn more information about those providers on the Medicare Compare website, or you can add them to your your list. So in this situation, we have selected that we want to do more due diligence about nursing home providers. So we clicked on this button over here that basically said we wanted to find nursing homes near us. So we just used the address of the office here, which is 80203. So what we're going to see now is a list of the providers that are close to our office. So on this initial search, there are 4 nursing homes. It gives us a map with the different pins and lets us know where they are. Gives us the name of the facility. It gives us the address of the facility. It also gives us this little red hand over here. And what this little red hand means is that there has actually been a confirmed case of sexual abuse or physical or abuse, basically, in this nursing home. It probably is a situation that has been managed and is taken care of, but this is called the red hand. And Medicare now, if there are reported and confirmed cases of abuse, you now can see which facilities have had those in their facility. The other thing that you can get from this is, on first glance, you can see this overall star rating. These star ratings are only available for nursing homes, for home care agencies that accept Medicare, and for hospices and hospitals. They are not necessarily available for all of the other types of facilities. That is basically the information that you get in this overall rating. And then you also get additional information here. So if you click on the provider, then you get the map, as I said, and the information. So now this is how you use this. Basically, you put in the name of the type of provider, you put in Briarwood. So now we're basically going to be able to look at more detail about Briarwood as a facility. So again, you can view additional pages, and not every provider is going to have the same information. So this overall star rating is what they get overall, but then they get individual ratings for different things. So the first one is health inspections. And this is basically the Colorado Department of Public Health comes in to do a survey once every 15 months to the facility. And they are going to look at whether or not that facility is in compliance with both the Medicare rules as well as the rules for the Colorado Department of Public Health that have been the laws that have been passed by the state of Colorado and then the implementing rules. So what we can see here is that they had an inspection, they had a complaint, and they had an infection control inspection. So those are the different types of inspections that they have had. This over here tells you what date those were provided, and then it tells you how many deficiencies they had in those areas. And if you go to the regular site, then you'll be able to review more information. The second thing that you can get in terms of nursing homes, as well as some of the other types of facilities, is what is the staffing requirements and then patterns. And so on these staffing requirements, it tells you basically how many hours and minutes of staffing that each resident gets on an annual basis. In this situation, they get a 5-star rating, which basically means compared to the national average, they are staffing above probably the national average. The third box down here is quality of resident care. And this is things like whether or not there are residents with ulcers, with pneumonias, with vaccines, different kinds of care that is being provided. And in the nursing home setting, that becomes very important if you should have to use that type of care. So the last thing we said that you could do in terms of this original screen down here at the bottom was that you would be able to print a report. So the different types of reports that you can print is that basically you can download your claims and personal data, and you can indicate what type of report that you want. So do you want your claims data? Do you want your personal health information data? What types of things do you want? And then you can basically click that, and then it will either download this as a PDF or as a text file, and then you can download that information to your computer, or you can print it depending on how you want to save that information. So that concludes basically how to use this particular Medicare.Gov manager in terms of how to manage your own information. It puts it all in one place. It then allows you, without having to go to multiple sources, to sort out this information. You can also find information on that Medicare Compare site about different physicians. So if for some reason or other you're looking for a physician, say a new neurologist, you're looking for a primary care physician, you're looking for a dermatologist, you can check out information regarding from all of those vendors or those types of providers as well. So what kinds of help or support then can the Colorado Gerontological Society provide? So you can give us a call and we can provide assistance with your current coverage. We can help you look at whether or not you want to keep or change your current Medicare Advantage plan or your prescription drug plans. If you're new to Medicare, we can walk you through that process. If any of you had signed up for the new to Medicare session that we had to cancel on Monday due to technical difficulties, we are rescheduling that, and that will be available next week. You can also get assistance if you need help paying for your Part B or D premiums, and if you need help with the plan finder or other special circumstances. If you need any kind of counseling and support, our general number is 303-333-3482. Our counseling line is 1-855-293-6911. And if you or someone you know needs counseling or support in Spanish, our Spanish line is 1-855-880-4777. This brings this part of our presentation to a close. If you have any questions, you can certainly send us an email at cogs@senioranswers.org as well. A lot of this information is also available on our website at senioranswers.org.